The mechanism of tooth eruption is not fully understood, but it is believed that it is a multifactorial process. Numerous theories have also been proposed. The first one being the root formation. It is quite obvious by the looks of it that it is a cause of tooth eruption as there is an overall increase in length of the tooth. However, according to clinical studies, experimental studies, and histological analysis, this is not the case. Root formation is not required for tooth eruption, however, it may accelerate the process. The second mechanism is the bone remodeling. Now, bone remodeling is linked with the eruption as bone growth supposedly moves teeth by selective deposition and resorption of the bone. Regardless whether it is a primary factor or not, dental follicle is required for eruption, and that it modulates bone remodeling. The next is the dental follicle. There is signaling that occurs between a dental follicle and reduced enamel epithelium, which causes cellular activity to occur and hence results in tooth eruption. Factors like colony-stimulating factor 1, which is a factor that causes differentiation of osteoclasts, results in eruption to occur. Other than this, reduced enamel epithelium secretes proteases, which break down the connective tissue to create a path of least resistance. Lastly, periodontal ligaments. As we've already know, periodontal ligament helps in tooth eruption. Their formation and renewal becomes effective for the eruption to occur. There are some molecular determinants that are involved in tooth eruption. Tooth eruption is a highly regulated process involving tooth organ, that is, tooth organ is enamel organ, dental papilla, and dental follicle, and the surrounding alveolar tissue. Tooth movements results by a balance between tissue destruction and tissue formation. Molecular factors such as colony-stimulating factor 1 and many others are also involved in the process of tooth eruption. Just like eruption occurs, shedding also takes place. For exfoliation, two factors are required. Number one is the odontoclasts. Odontoclasts are similar to osteoclasts, that is, they resorb. Osteoclasts resorb bone, while odontoclasts resorb dental hard tissue. Second is pressure. Pressure from the erupting permanent tooth plays a role in the exfoliation for the deciduous teeth. Also, muscular pressure plays an important role in the exfoliation of the deciduous teeth as well. There's a pattern to exfoliation as well. For the most part, it is symmetrical, except for second molars. The mandibular second molars exfoliate first, then the maxillary second molars. The sequence of exfoliation in mandible follows anterior to posterior pattern, while in maxilla, exfoliation of first molar before canine disturb the sequence.